First, I have to say there really isn't an agreed upon definition for a food desert. It's very much contextual. And the way I define food deserts is any neighborhood that has poor access to nutritious, affordable, and healthy foods. You know, during the 50s and 60s, there started to be a lot more building out in the suburbs. And supermarkets decided they didn't want to stay so small and they wanted a bigger footprint, and so they would go out to the suburbs, they'd build these giant parking lots, much larger footprint store, and they thought that was sort of the way up. A lot of urban areas where you have low-income residents, you see poor health outcomes in those neighborhoods, meaning, and this is not all related to diet, but a significant portion of those outcomes are related to diet. At least there's a correlation. You can't necessarily say it's causal, but you find that residents have a higher rate of cardiovascular disease, higher rates of diabetes. Some cancers are also considered, a third of the cancers can be attributed to diet, and you see higher rates of those as well.
So my name is Laura Fox, and I am one of the co-coordinators for the Baltimore Virtual Supermarket Program, which is a Baltimore City Health Department program. It really is a collaborative effort between Santoni Supermarket, Enoch Pratt Free Library, MICA, the Baltimore City Public School funders, the United Way of Central Maryland, and the Walmart Foundation. The Virtual Supermarket Program is a food access program. So this program allows residents in food deserts in Baltimore, so areas that lack access to healthy and affordable foods and generally have an abundance of unhealthy options like corner stores and carryouts. It gives them access to healthy and affordable foods in the very neighborhood they live in, allowing them to bypass the difficulties of traveling far to get to a supermarket.
They chose Santoni's to help, for the order fulfillment process because we are a family-owned and operated. They have one point of contact, that's me, and it's much easier, from their perspective to deal with a, smaller, company as opposed to a, large chain store where they may not be as flexible.
The virtual supermarket, to me, it's a response to a need that we don't know if it's going to work. I think the jury's still out. There isn't enough data, and I know those guys have worked on outreach in there. They continue to work on that and trying to get people to try something new. It's a different way of shopping. For some people, it's uncomfortable. But I think one thing to keep in mind is that a lot of these neighborhoods are never going to have a supermarket. And in the absence of that, how do we respond to that, and how do we try to fill that? And for some people, I think particularly maybe seniors, where they have time during the day, because of the times that it gets, you can make the order and the times you pick up, maybe aren't so convenient for some people who are working full-time or have daytime jobs. But for a portion of the population, that might be the answer.
I would love to have stores in the food deserts. It is a challenge. I'll be very candid with you. It is a challenge to build a store in a food desert community or a urban location because there are other factors. You need more security. You need, the shrink level is higher. You may not get as good of help. So there's all kinds of factors. And with the failure rate being so high, that's something that you really do have to look at.
This is not just a private market issue, and we've left it in the hands of the private market, and it's failed. And so if we want if we can sit around and wring our hands about all these terrible public health outcomes, but if people don't even have the opportunity to purchase healthy foods, we certainly can't hold them accountable for what's happening with their health.
A 50,000 square feet can employ, 150 people. And that's very, that's very real. That store may do, X amount of millions of dollars, but a store like, your average store today can put 2 million to 2.5 million paychecks back in the pockets every Friday of, people within that community.
We live in Southwest Baltimore on Wilkins Avenue. I get my groceries from like Columbia a lot of times, from Trader Joe's, or sometimes if my roommates will take me to Towson to go. I also sometimes will walk like 2.5 miles to an international market in South Baltimore so I can get like cheap produce.
Well, I go to school in Towson, so sometimes on my way home I'll go to Trader Joe's or the Giant right next to it.
That's pretty far.
Towson. Yeah, that's like 40 minutes from here.
Yeah.
And then in the summer we'll do the farmer's market. We'll go to the farmer's market, and occasionally we shop at Aldi down the street.
The farmer's market's like 15 minutes away, 20 minutes away. It's more
under the overpasses.
Towards downtown Baltimore, kind of far from here.
Yeah. So that's where we get our produce.
Well, a lot of the neighbors that live here, they don't have cars or vehicles. So you'll see a lot of times people with these carts, and they'll be pushing them. And even in the grocery store, they sell the carts, like at the dollar stores and some of the stuff, so you can get these carts, so you can push the carts with the food back to where you live, because they live so far from the grocery store. Yeah, I mean, we used to have the Arabers that would come around. I think that was one of the best things we had in the neighborhood, because they would come right to your doorstep, right to the block. They had all kind of fresh produce. They weren't using any type of like fossil fuel. They just had the horses. It was wonderful, but now they're gone.
I'd like to maybe see classes about eating healthy and what that entails and how you can do that on a budget, and maybe providing more options and cheaper produce to the neighborhood.
I would also like to see some type of, legislation passed for zoning. Like, zone the neighborhood where you can't bring unhealthy restaurants into the neighborhood. We don't need any more Chinese fast food spots. We don't need any more liquor stores. We don't need any more pizza spots or chicken box places. The people that own them don't live in the neighborhood. They take all the resources out of the community, and they put food that's not good to eat in the community. My name is Joshua Smith, and I live in the food desert.
My name is Casey Haggerty.
My name is Daniel Haggerty, and we live in a food desert.